I'm all good. Dr. Rabadi, first of all, thank you very much for taking time off your busy schedule to sit here with us. But I feel like it's extremely important to tell the people of Yonkers the do's and don'ts and to give them clear information of what's going on and what do they need to do to stay safe.
That's my pleasure. Thanks for having me on. And every time I get a chance to speak to the community, it's always a pleasure because I feel like preventive medicine is right now the most important thing in this battle with the COVID-19 coronavirus.
Now, doctor, this is a serious crisis, isn't it?
I've never seen anything like this in my life. I've been practicing now since 2001, and I did not work during the AIDS epidemic in the early 80s, but from the doctors that I speak to that did work, they said this is just like it, maybe even worse.
Worse? I would think it's worse.
Yes.
Now, doctor, with all these, I have seen you at was on Monday when you spoke at the live stream with Mayor Spano.
Town hall, right?
Town hall. Now, I'm sure that you got a lot of questions. Of all those questions, let's address the one that you think it's most important that people need to know.
What can you do as someone who lives here in this community or lives in New York, in the United States? What can you do to help the situation? I think everyone realizes or has heard staying home is very important and social distancing. This virus is aerosol spread. It's in the air. So if I cough right now, a cloud of bacteria is around me for about 10 minutes. And if you walk into that cloud, there's a very good chance that I can transmit the virus to you if I was positive.
Now, doctor, it has been, I know that things are changing every hour. Information. In the beginning, most said that we did not need masks. Now they are saying that we do need masks.
That is correct. On Sunday, they came out with an article saying that if you have a mask and you're outside your house or going into a group of people, it's better to wear a mask than to be without one. It does help prevent your risk of contracting the disease.
Now, this is a question that people have been asking me on my forum. We order food. They deliver the food.
That's a great question.
Is it safe?
Yeah.
Because we don't know who's cooking that food. Yesterday I went into a deli to buy coffee because I must have my coffee. And as I'm walking in there, I see the guys who work in there, no masks, no gloves, preparing the food to be shipped out, to be sent out. That food somebody else is going to eat. How do we know that those guys are not contaminated?
That's a great question. And the answer to that is two parts. If you're ordering takeout to your house delivery, for example, a box of pizza comes to your door. You open the door, you take the pizza. Right away, you should take the pizza out of the carton, put it on a platter, and throw the box outside because we don't know what that box has on it. The pizza itself was cooked in a high temperature, and most viruses die off in high temperatures. So that's a good thing. Eating cold foods, there is a risk, like a sandwich, a cold cut sandwich. Someone does it, makes a sandwich. The transmission from a cook or someone who's cooking for you, someone who's making a sandwich for you, is still there. That's why you want to make sure we spread the word. Everyone should be wearing gloves and masks, especially when you're preparing food.
So do you suggest Chinese food? That is something that we should stay away from, doctor?
The Chinese food has nothing to do with this virus right now here in the United States. The fact that the
No, that's not what I mean. What I mean is the food on the Chinese food comes inside of a container.
A container should be taken out of the container right away into a platter. The container should be thrown away. Any container, whether it's Chinese food, pizza, Italian food, any type of delivery, let's just say, that comes to your house, take the food out of the container and throw it away. If you're buying, another question similar to that rule is if you go shopping and you're buying the groceries.
That was my next question.
The groceries should be wiped down before you put them away in your closet and refrigerator. Wipe them down with some kind of disinfectant wipe and then throw all the bags away. Or if you're using the recycled bags, clean them and put them away in a safe place.
Pregnant women working, they might not get the virus, but what about transmission to the baby?
We talked about this morning, actually. So, with a pregnant person, you're dealing with two patients at least, right? Unless they're twins and triplets. But in a pregnant woman, you're dealing with two patients. A pregnant woman should take the same precautions. However, a lot of these detergents and cleansers that we're using, a pregnant woman inhaling these types of bleach and Lysols and these heavy disinfectants that we use does pose a risk on a pregnant woman because it can affect and cross the placenta.
Doctor, the other day that when we were chatting, I think on Instagram, you said something that to me was extremely strong. That doctors, you don't want to be in a position of deciding who lives and who dies.
Right. So what that was about, the state of the hospital is discussed every day. We have a corona team, and we discuss how many beds we have, how many ventilators we have. Last Monday during the town hall meeting, I received word that day there was only 17 ventilators left at St. John's. Now, if there's 17 ventilators and we got 30 patients in the ER that are in respiratory distress, who do we use that ventilator on? So make our job easy by staying home and try to avoid contracting this virus. There's a scorecard that we use at the hospital when we're running low with something like a ventilator, and we give the ventilator to the person that scores the highest on that scorecard, and the scorecard will rate the age of the person, the comorbidities, which means how many diseases that person has and what's their chance of living. And are we using the ventilator on the right person, or should we be using on someone who has a better chance of living? This morning, we received 50 more ventilators. So thank God, right now, the hospital is in a good position with ventilators. We're actually doing a great job at St. John's and at St. Joe's with the COVID virus.
Doctor, I heard on your speech at the City Hall your suggestions in case if you feel that you are infected. Call your doctor, he will give you a set of instructions, follow those instructions. If you still feel that you still think that you have it, call your doctor back and he will give you another set of instructions. Great suggestion. But let's say I'm a homeless. I don't have a doctor. Okay, and maybe I don't even care if I have the virus. But the fact that I don't care that I have the virus does not mean that I'm not passing it on to somebody else.
Really, that's a great point. The most dangerous person right now is the asymptomatic positive COVID patient. That means this patient A has the virus, does not have any symptoms, but is walking around and infecting people. That's the most dangerous patient to me. What do we do with that patient?
Exactly.
Someone who's homeless, what are we going to do? Where can we isolate that patient? You can't go to the Y, you can't go anywhere right now to find a bed and isolate yourself. I feel bad for them and I pray for them. There's nothing more we can do for that patient right now.
But doctor, that person is in a place with a whole bunch of other homeless,
Right.
in a sharing type of community.
Right. So
that's a nest.
Those patients are considered a hot spot zone where we assume right away that they're positive.
That's the other question. Right now, assume that everyone got it.
That's the mentality we're using.
Assume that everything you touch is contaminated.
Yes.
So protect yourself. I have my gloves, I have my mask, and so does the doctor. If you see a death, in your neighborhood, and you see, measurements being taken to remove the body, assume that it might be a person that is contaminated. Take nothing for granted.
Right.
Okay. No one, you don't get infected if you take an abundance of protection. You should take it, correct?
Yes. Definitely always be vigilant. Assume, just like Rui said, everyone is positive. This is a new way of life. This is not going to stop in a month or two. Continue like this. Coronavirus is not going anywhere anytime soon. We're looking at least till the middle of May, maybe towards the end of May with this virus right now medically. We don't see an end. We don't see light at the end of the tunnel right now.
Doctor, how many, people, I've been asking this question, how many confirmed deaths in Yonkers? Oh, we don't have the numbers. Westchester County is not releasing the numbers. But we know the numbers. I know more or less the numbers.
I will tell you this, without giving the exact number.
More or less.
We, at St. John's, we own Park Care, which is Yonkers General Hospital, the old hospital on Ashburton. We just asked the state for permission to open up that morgue. St. Joseph's Hospital, their morgue is full, and they have a refrigerated truck that they're going to be using. And it looks like we're going to be using those similar trucks also. We are probably in a few dozen right now when it comes to deaths. It's difficult to give the exact number because not everyone that dies in the hospital right now is exactly from corona because multiple things. Let's say someone came in yesterday to the hospital, was admitted, we tried to scan them and order the labs for the coronavirus. It takes several days for that result to come back. If the patient dies a day later from respiratory distress, it could be pneumonia from another cause. We're not sure yet. So to give that exact number right now is difficult.
That's important, doctor, and I'm going to tell you why. There was a pickup of a body somewhere in Yonkers. I don't want to give the exact address. We know there was respiratory issues. Body was picked up. We said that it might be coronavirus. Somebody who claimed to work at a medical center in Valhalla said, no, body got here and had nothing to do with coronavirus. But I have worked at UMDNJ for a long time, and I have seen autopsies being done. I was right there in the room. And I know the results don't come out immediately. Parts of body are weighted, sliced, and taken to the lab. The fact that you see and somebody tells it was not does not mean much, because the results from the lab are not out yet, correct?
You're correct.
I'm correct.
We're not sure. Yeah, we're not sure yet until the autopsy comes back. Or let's say they came into the ER and they were still being resuscitated and we drew the labs. It takes several days for those labs to come back to confirm whether or not it was corona.
So guys, you heard that. Just because somebody works at the morgue in Valhalla and they tell you no, there was no coronavirus, does not mean that it was not. And my recommendation is assume that everyone is infected. Take precautions, take nothing for granted.
And also remember, just because of this pandemic with corona, obviously a lot of people are infected. Two things I want to remind everyone. The recovery rate is still high. 90% of the people recover. So don't panic and think, oh, I'm positive corona, I'm going to die. No, that's not the case. I have a lot of positive patients that I'm dealing with that are doing just fine. The second thing is, just because it is a pandemic with corona, I had a patient yesterday who came in here with chest pain, shortness of breath. He thought he had corona. He wound up having an arrhythmia. So there's still other diseases that continue, like stroke and heart attacks and gastritis and multiple other diseases that we still need to be vigilant and aware of. So please don't always think right now that I got a symptom of a fever, this is corona. No, it could be many other things. And allergy season is here. So the sniffles and the coughs are abundant right now. And that's not always corona either.
A question from Hector Santiago. How do we know who is symptomatic or not? Wouldn't that mean everyone should get tested?
Yes, Hector is correct. The best way to beat this virus is to stay home and get everyone tested so that we can inoculate the ones that are positive, and then life goes on for the people that are negative, but we continue with the lifestyle changes that we've been implementing for the past several weeks.
People with little ones at home, how is their immune system? Maybe people that just gave birth, 2-3 months, a year old, they go out, they might not showing anything, but how can that affect that baby? Is more...
Two things. Most children have a strong immunity, and right now we haven't seen the coronavirus really take effect on children. We did have a 6-month-old baby that I saw yesterday somewhere in the Midwest, 6-month-old, or 6-week-old, I take that back, 6-week-old, that died from complications of coronavirus. So it can affect the newborns, it can affect children, but right now we're seeing it more with the young adults and middle age more than anyone else.
But don't take it for granted that young people don't die because of this. Don't take for granted that you're young, you can do whatever. And even if you don't die, even if nothing serious happens to you, you can infect your grandpa, parents, your mother, your father, whoever. So just because you're young...
So I'll give an example of that, Rui. One of my patients went away on spring break to Florida last month, came back, and her dad, who's in his late 60s, has COPD, is in the hospital right now with the coronavirus. She looks like she's the one that gave him the virus. So just because you feel good and you think you're invincible, there's a threat and a possibility you may transfer the virus to someone who cannot handle it the way you do.
Now, doctor, I hear of a lot of body pickups in private residences, building. Some people are saying that's coronavirus related. Some people are saying that are not. I hear to the calls, and most of the calls that are coming through, respiratory symptoms. And that's a sign, not necessarily, but the numbers escalated up. Yeah. Is this true? They are picking up bodies in private residences, that, as far as you know?
As far as I know, yes, but we can't technically say that it's coronavirus. It
No
is the
results
winter.
yet.
It is the winter, and during the months of December through April, influenza still here, parainfluenza, people with underlying disorders such as asthma, congestive heart failure, COPD, emphysema. These patients, when infected with something like influenza or pneumonia, they can also suffer from respiratory distress. So it's a common time of the year.
I've been doing this for 11 years. Every year at this time around, I'm around, and I have never heard so many calls.
I know.
Never.
It's scary. It's a scary time. Take this very seriously, folks. This is a bad time. The hospital right now, you walk in there, the hospital that I work at St. John's is considered a COVID hospital. Right now, we're trying to take all the healthy patients or all the patients that are non-COVID and transfer them to the Dobbs Ferry campus, to Dobbs Ferry Hospital, and keep St. John's Hospital as the COVID hospital so we can try to separate the two groups.
Is there any sign that can identify, is this a pneumonia or is this COVID-19?
Yes, on the CAT scan of the lungs, it's a really good test to differentiate whether this is something like a community-acquired pneumonia versus the COVID. You can tell there's certain patterns called ground glass appearance. That's the word you can Google, ground glass appearance. That's the look that we see on the CAT scan of the image of the fluid from that respiratory syndrome.
Angel, in your question, why aren't we 6 feet away? We're about 3 feet away. We have masks, we have gloves. So we kind of taking the measurements, you know.
Yeah, in the ER, we're about 6 inches away from each other, the staff, but we all have masks on. I wear my goggles to stop any airborne diseases from going into my eyes, and we have gloves on. Unfortunately, because the way the camera lens is, Rui and I have agreed to both wear masks to protect ourselves.
Correct. Now, doctor, the ammonia question. Yes, in a hospital scene, you can, you know, differentiate one from the other. But what about at home? I'm home and I don't feel good. How do I know if it's an pneumonia?
You can't differentiate it. That's why it's important to call your healthcare. Hopefully everyone has a healthcare provider. That's why it's so important to have a primary care physician in your life, someone that you can lean on and talk to in times like this. I'm telling you, I'm getting phone calls every single day from people, and I appreciate it because you're taking my advice. And now we went virtual, so even at home, I'm going on my laptop and I'm doing a face-to-face visit with my patients and going over the symptoms. Fever, shortness of breath, cough, headache, now diarrhea also. Add that fifth one, because that's part of the COVID. Now I see a lot of diarrhea as an early symptom. If those 5 symptoms, you must speak to your healthcare provider. The first thing you should do is not call your healthcare provider, but isolate yourself. Stay in a room, stay away from your family. If the fever persists, you must speak to your healthcare provider. If it goes away after a few hours, think that you're positive and that you can pass this virus to somebody else. So kind of still isolate yourself. It's a new way of life, ladies and gentlemen. This is our new lifestyle. Symptoms like this cannot be taken lightly anymore. You must take it seriously.
Now, doctor, great advice. But the majority of the people who live in Yonkers don't live in a house. They don't have a basement to quarantine themselves.
Right.
They have 4 or 5 or 6 people in the same house.
Correct.
How can you realistically quarantine yourself?
Right, that's a good question. Not everyone is fortunate to have multiple rooms. Some people are sharing beds or sharing mattresses on the floor. Quarantining is impossible. You can still do things like being 6 feet apart if possible, wearing a mask, gloves, sanitizing, airing out and ventilating the rooms is very important also.
Our Latino community, many of them, multiple families live in the same apartment with kids and adults, sometimes 2 and 3 families in the same house. How in the world can those people stay safe, maintain the distance, quarantine if necessary? Once one get it.
Social distancing in that perspective is impossible. But things that you can do is still sanitize. Do not share utensils. Don't touch surface areas directly. Sanitizing the counter, the railings, the doorknobs, the faucets, anything that anyone can touch should be sanitized at least 2 to 3 times a day with a good disinfectant, a strong disinfectant. Those are easy, simple ways to do it. Social distancing, though, Rui, in that point of multiple people living in 1 or 2 rooms is impossible to do.
Impossible. In question of using the spray to disinfect places, Clorox in the bottles, just spray, is that good enough?
Bleach, Clorox, Lysol. If you don't have those things, just some heavy soaps and hot water is just as good also.
I hear the suggestions and recommendations, but some of them are just, in my eyes, just impossible to follow,
Right.
or just extremely difficult.
Right.
You have no idea. You go to a store, and they only take in 2 or 3 people at a time in order to comply with the distance. But who the hell knows if the guy who was there before coughed and he walked out and I'm walking in?
Yeah. Suggestion now, we brought it up earlier, wear a mask when you're in public. Wear goggles or some kind of eye protection.
Doctor,
Wear gloves.
the ship that just arrived in New York City
Right.
to assist. I understand that it's not for coronavirus people
Right.
infected, but it's going to assist in relationship to the coronavirus.
So I'm gonna be working there. Hopefully this weekend. I submitted my application, and they're doing a Navy clearance, and I'm going down there with a group of physicians volunteering. It's to help the community and take the load off the hospitals from New York City that are overwhelmed with the corona. Remember what I said earlier, still diseases such as heart disease and strokes and other infections still are happening. That doesn't stop right now. Those patients would be referred to the UNSN.
Do you know if they will be assisting patients from Yonkers too, or just New York City?
It looks like more like New York City. The ones from Yonkers, we are opening Westchester County Center and converting it into a hospital. Should be ready within the next week. We'll be volunteering there also.
In regards to the respirators around our city, not just Yonkers, not just St. Joseph's, St. John's, Mount Vernon, what's the count?
Okay, so
how many do we need? How many do we have?
As of Monday's count, St. Joe's, I believe, had a handful left. Lawrence Hospital had none left as of Monday morning. St. John's had 17. We just got another shipment in of 50, so we're good right now at St. John's, and we're going to share some to the local hospitals. I think Governor Cuomo is doing a great job. A lot of companies now are coming in. We got a lot of donations also for some personal equipment for the staff, and that's our biggest problem right now is personal equipment and finding staff. We're short of nurses right now. The ICU at St. John's has been converted and expanded. We're using the emergency room now as an intensive care unit also. So we have the space, but we don't have enough nurses. And a shout out to all the nurses, Rui.
Definitely.
The ones that are out there risking their lives are the nurses first, not the doctors. I will take a back seat to any nurse and bow to them right now. They're doing a phenomenal job, and I thank them every single day for coming to work.
Now, do we want to give a shout out to maybe a retired nurse that we need them? We need them all, doctor.
We need the retired nurses. We need the retired physicians. Today, they just called out, I believe, 10,000 military medical personnel to come back and help the front lines. We are getting bus loads into New York City from the southern states of medical help that are on their way here. This has not become just a Yonkers or New York state. This is becoming, obviously, it's a pandemic, so it's worldwide. But the United States right now is truly sticking together, and we appreciate the entire medical force out there.
I've been getting a lot of questions. Where is our mayor? Where is our mayor? Well, our mayor was live only a few days ago.
Correct.
I interviewed him a couple of times.
Correct.
And my understanding, there is no need for the mayor to come on daily basis because we have updates on daily basis from the governor. Only thing that would change in Yonkers is, okay, now instead of having 300, maybe we have 310. So,
but just because you don't see the mayor out there publicly on TV giving a press conference like Latimer does or Como, the mayor is in touch with all the hospitals every day. He's in touch with all the employees. I speak to him pretty much on a regular basis from my department over at the hospital. I am the vice president of the medical board, so the mayor and I are constantly speaking to each other. He is very aware of what's going on. But when it comes to Yonkers, you got to understand, Yonkers is part of Westchester County, and George Latimer, our county executive, who's doing a great job, he's the one responsible for the DOH, Department of Health, and the county in this type of situation. We don't have a Department of Health for Yonkers. We defer to Westchester County.
Another question from Hector Santiago. Is there any way for people who do not have medical expertise or background to help?
Hector, very kind of you. I will say to you, Hector, can you help? If you can help with trying to get us some masks and some gear to put, like the gowns and the headgear, that's what we're really running low on. The masks, I think we're okay. We just got, I believe, 10,000 masks donated. Gloves were okay. If you can get us some headgear and gowns, people like the unions that have the painters and the welders that wear those headgears and the gowns, we can really use those at the hospital. And that's one thing you can help us with, Hector, and any of your family and friends. We would appreciate that.
So let me jump on what the doctor just said. I know people are afraid to go out, people don't want to get out of the house. So if you have the items that the doctor just mentioned, send us a message. I will drive to each place, pick it up, and then drop it off whatever place needs to be dropped off. Where would I drop off things, doctor?
You can drop it off right to the security desk. You don't even have to get out of your car. You pull up to the hospital, you beep the horn, and you can call and say, I'm outside. It's 964-4444. That's 964-4444. Tell them I'm outside. You can leave the box right on the sidewalk. You can stay there till the security picks it up, and we would appreciate that very much.
So guys, you heard it. If you have anything at home that can be useful to hospitals, doctors at this time, gloves, masks, what the doctor just described, send me a message, private, not on the thread, because there will be too many for me to go through all of them. Send me a message with key information. What do you have? Where is it? What time can I pick it up? I will go around, and since this is a actor's suggestion, I will drag him along. Hopefully his car will be okay and his phone will have full battery. So Hector, charge your phone. I pick you up and we go around, we pick up the stuff and drop it off at the hospital.
And the other way people can help is staying home. That's another big help. And things that you can do at home to build your immune system. Building your immune system right now is very important. One of the recommendations was taking vitamin C, 2,000 milligrams daily for 7 days, and then go back to the regular dose of 500 to 1,000 daily. But you want to do that for 7 days and boost yourself. Zinc is being used now worldwide as an anti-inflammatory and immune booster during this type of syndrome of COVID. Also, vitamin D and vitamins that are high are riboflavins. Riboflavins are found in vegetables. So eating a healthy diet, I said that on Monday, is still very important, because once you still respect your body hopefully will respect you back. And that's a very important thing to remember.
So guys, stay home, stop the spread, save lives. So those are 3 things you need to think about it. Anything else, doctor? Anything else that comes to your mind that we want to let the people know? Because, you know, I've been saying this for a week. Is it time to panic? I don't know. I'm panicking.
I tell you what, we're panicking. We're trying to be brave. At the same time, we're panicking. We're worried about our own lives. I come home to a beautiful wife and 4 children, and it's difficult to imagine if I can spread this to my children. I wanted to live in a hotel for the past several weeks, but my family refuses for me to leave the house. So what I do, I'm fortunate enough that I have a garage. I come home into my garage. I have a change of clothes waiting for me. We take all the precautions necessary. We wash up and clean up before we enter the house. I do try to distance myself a little bit from my kids. I have a 2-year-old who's attached to me, so it's extremely difficult to not hug her and kiss her in the morning. But it is difficult for all of us to think what we can do to and harm our family with the damages that we're getting from the hospital.
Doctor, I think it's extremely important to give people the right information. Okay, I didn't want to bring politics into this, but I have to, because politics and this is intertwined.
Okay.
We heard the president in the beginning minimizing the impact. Right. Because of him minimizing the impact, a lot of people who supports him 100% regardless of what they say will not take this serious. Right. Okay. He said that we had 15 and miraculously in about a few days we'll go to 0. So people start not taking this serious. They go out there, they don't care, and they spreading. So I give people the raw thing. This is it. Yes, be scared. Okay. Will misinformation actually help expanding this virus? Shouldn't people have the real thing and let them decide what they should and shouldn't do? Why are we protecting people from the truth?
Right. I don't think your question is a valid one. It's a good question. But I will say this. Even us as medical professionals, we were not sure 2 months ago. I thought this would be over in 2 or 3 weeks. I thought it was just a little cycle and it was going to go away. I don't think the president realized how severe it is. Well, look at Korea, the country of South Korea, which is, I believe, about 1/6 or 1/7 of our population. They did a complete shutdown of the country for 2 weeks. Italy now is doing a complete shutdown. I think that if we did the complete shutdown 1 month ago, I think we would be in a better place. And you know how they talk about the spike of the disease versus the plateau? The spike means we're still replicating and making more. The plateau means it's calming down. It's coming down, downward trend. I felt we would be in a plateau by now and downward trending. The spike is still going, and you're going to see this spike for another 2 to 3 weeks. That's my medical opinion, and that's from the knowledge that I've obtained just reading and going online with the Department of Health and the CDC.
Doctor, his statement was not just in the beginning. Maybe just a week ago he said that by Easter, he would anticipate. So he continues to minimize this virus.
You did see the report in California that because of the isolation and the quarantining they did, they've seen a decrease in numbers. We have not seen that yet. So yes, by the president saying by Easter, maybe in certain areas of the United States, definitely not New York. I don't see it clearing up in New York in the next week or two.
Leonardo Santosuaso, he just said, Doc and Ru, I was just told that pink eye is a symptom. A friend of his wife got it and got COVID. I guess symptoms are changing day by day.
Lenny, that's why we wear glasses, goggles, protective eye gear, because the virus can go into any mucosal opening, whether it's the nose, the mouth, or in the eye. That's why they were saying in the beginning things to do and not to do. One thing that you should not do is rub your eyes, put your fingers on your face, always sanitize, and keep that area away from exposed. When you're in the exposed area, you should keep it covered.
So guys, right now, anything can be a symptom. Right now, we don't know everything. Remember, diarrhea wasn't a symptom maybe about a week ago.
Correct.
The pink eye wasn't a symptom. This is the first time I'm hearing about it. So anything can be, and things will change dynamically. Every day, they might come to a conclusion due to on data that this is a symptom. So don't play around. Don't play around. The Old General, they're saying that they're going to use the Old General as a hospital to deal with the COVID.
Yes, we're going to be clearing up some floors there. We haven't decided whether it's going to be COVID. It will assist us with the COVID. We might just send patients that are ill with other types of diseases there.
John, the president, is the leader of United States of America. People listen to him. Words do matter. Like it or not, they do matter. Just like what the doctor is saying, his word and his expertise does matter. People listen to him and assume that he knows what he's talking about, and we're going to follow the suggestions. The leader of United States sets the pace, and people will listen to him. So words do matter, and elections have consequences.
And John, this is not an anti-Trump thing. We're just saying that what President Trump said is true in certain areas of the United States, but his comment that he said that this will be resolved in a week or two, I don't see that happening, and none of us see it. I mean, you see the news every single day, and we're reading and speaking to other hospitals. We don't see that plateau yet. So all due respect to the President of the United States, it just not here in New York yet. Maybe in Kansas, in the Midwest, in those areas, we've seen a downward trend. Like I said, California has a downward trend right now because of their aggressive quarantine.
Correct. This is not about the president. This is about lives of American people. So, doctor, I know that you gotta go.
Yes.
I know that you gotta go. Thank you for taking the time.
My pleasure.
Hopefully, this information was of value to you guys.
More testing is going to be the answer. Again, if we can get more tests out there, the 15-minute finger prick test will be out next week. That is a simple blood test with a finger prick. In 15 minutes, we'll get a result. We found companies that will be bringing it to us next week. So if you need to get that done, please reach out to your healthcare provider, see if they have it. We will have it at St. John's. I'll have it here at my office. Be more than happy to help everyone out. We are limited with testing, so please take this very seriously. If you're having any symptoms of fever, headache, shortness of breath, cough, if you're having symptoms that are GI, gastrointestinal, you really need to speak to your healthcare provider and at the same time isolate yourself from everybody. Help the community. This is not a moment of punishment. This is a moment of solidarity for us to come together and beat this disease.
And guys, I don't know if I'm correct or not, doctor, so you correct me if I'm wrong. The fact that you take a test today and it's negative does not mean that you cannot be positive next week.
We had a case here in my office 3 weeks ago. She was negative. Yesterday she was positive.
So regardless if the test is negative, continue to take the precautions. It's not that it's negative, you're immune to it. You're not.
Correct.
So thank you for watching. Thank you, Dr. Rabadi,
pleasure.
for taking the time.
Elbow.
Elbow down.
See you later.
So hold on. Let me